Looking into the heart is no longer an unusual event in Europe. In many heart catheter laboratories, specially trained personnel look after the health of their patients. With more than 2.5 million interventions per year, this examination is now part of the routine in Europe. The modern self-understanding of the clinic personnel requires up-to-date, cost-effective and effective treatment methods. In general, the punction sites, 90% of which are in the inguinal region, require effective care after every intervention. Starting with the simple sandbag which was used in former times, bandages or adhesive bandages and sometimes cost-intensive special closures are used today. We will take a closer look at the common pressure bandages in the following. First, the lock is removed, then the punction is compressed until there's initial stoppage of bleeding and several compresses are placed on the wound to increase the pressure. A bandage is applied over this. In order to provide secure fixation, the adhesive bandage is placed over the compresses in several strips. The bandage cannot be repositioned. After several hours, the bandage is often rolled in at the edges and therefore cuts in strongly. In many cases, the strongly adhering bandage strips cause tension blisters in direct skin contact and lead to unpleasant allergic reactions in the patient. Therefore, the bandage has its problems, particularly in older patients. The removal of the adhesive bandage is often difficult and time-consuming, since the latex-containing adhesive layer then holds even better than at the beginning. There's also a risk that mechanical stress on the skin causes the wound to reopen when the bandage is removed. Treatment with bandages. In order to guarantee sufficient and particularly secure fixation of the pressure point on the punction site, two broad bandages are often used, and additionally fixed at the end with several strips of adhesive bandage. The repeated lifting of the patient's pelvis places a strain not only on the patient, but particularly on the spines of the personnel. The application usually requires two trained persons. The time requirement is high. The subsequent correction of the bandage or the application pressure is only possible with great effort. The bandage is often discarded and a new bandage is applied. The bandages are discarded after use. The tendency of the bandages to roll in can easily lead to cutting in and skin lesions. In summary, it must be said that a wrapped pressure bandage requires considerably more time, often significant strength cost to the patient and personnel, and clearly makes it more difficult to correct and assess the pressure points subsequently. The quick pressure bandages from Werkmeister, on the other hand, attempt to avoid the disadvantages of the above-shown methods. Regardless of whether it's the washable Cosafix or the single-use bandage Cosafix, both bandages are safe, quick, easily applied, and can be corrected without problems. It offers high-wearing comfort with an ideal fitting form, ensures the fixation of the compression on the punction site, and ensures that it's easy to assess the punction site. Simply spread the Werkmeister pressure bandage out on the patient bed. Before removing the lock, apply the abdominal belt firmly but not too tightly. Then quickly check the position of the leg belt. Then squeeze off and after putting on a compression pad, simply press against the hook and loop side. Close. Cosafix is a high-quality textile bandage which has thus far been used in more than 200,000 applications internationally. It's easy to put on, subject to strict quality controls, and can be washed up to 10 times if needed. This makes it more cost-effective than customary methods. The Cosafix single-use bandage consists of a special, light material with micro-hook and loop closures, which has been used in this bandage for the first time worldwide. The pressure bandage provides a secure and reliable hold. The pleasant absorbing material and its low weight allow it to comfortably and reliably fulfill the requirements which it must provide. Cosafix and Cosafix are more cost-effective than customary pressure bandages and less expensive than closure systems. The compression pads, also called pressure points, are optimally coordinated with the bandages. They support the pressure of the bandage. The single pressure point Speedy is available in the form of a half pair and the roll, similar to a bandage roll. The pressure point Cherry, in the form of a mouse, can be washed and therefore reused. The selection of the right compression pad subjectively depends on the experience of the users.